Well, the response is, all we have said is a principle of tried tents or fever clinics, which is what it means is that there must be a place where patients will come in, where they'll be able to observe distances, where they'll be able to ask them questions, check their temperatures, and then make sure that senior people, senior nurses, senior professionals can assess them and bring them in. That means that they can use an existing building if they have one, repurpose it and then see people in there, or they can create a new building and then use that, or they can create a tent, even a marquee, and use that. Then they must from there have a place where all the persons under investigation will be admitted and observed for the duration of their observation and treatment, which is clinical management, as they wait for the results. Once the results come in, they'll be able to say whether someone is positive or negative. And if you are positive, you move to the positive, COVID positive side so that you don't cause infection. And then if you are negative, you go to the COVID negative side to stop what we call nosocomial infection, which is an infection that you acquire through the hospital. So that is the issue. So the point is not that there will be the same structure everywhere, but the system has got to be the same. That's why, for example, I went to Northdale Hospital, and I make this example because in Northdale they converted what I used to work there. It was now a kind of gateway clinic. It used to be a cafeteria, was converted into a gateway clinic. They shifted its use. That's what they are now using. I looked at it. They are organized. They have distancing and everything. So in different hospitals, I've seen that, and so it's a standard approach in terms of the system. As to what you use for that, it's up to the particular hospital. In Gauteng, we put up a number of tents, and so they used a lot of marquees. And when the surge came, I actually had an emergency meeting, and we went through, and I said they must put up observation beds, and then they did observation beds. Then a number of hospitals that about 14, 15 beds, and I said this is too few, they must push them up. So they increased the numbers to 50, 100, and so on, because what was now happening, it was creating a bottleneck where people were stuck at the admission area and not going to the wards. And that's how we ultimately opened up and ultimately got people to go into Nasrec and to some of the COVID-19 ward inside. So that approach helped us to be able to decant the observation wards and also remove the bottleneck. Initially, people thought that the Gauteng hospitals were full. They were actually never full. Now it's clear because they were able to open that. So management has to take charge of how they change that. Where they were weak and then we thought there was a problem, we set up an emergency intervention team which had to go in there and do that. And that's what they're busy dealing with. We then said, if you find a place where you think that it's something that can be used long after COVID-19 is gone, repurpose that, refurbish it. That's why yesterday you were seeing that we've been seeing a number of such buildings where we refurbish them for future use, because again, we don't want to lose everything as a temporary structures. We want to make sure that we invest for the future. So that's the approach.
All right, that story is related to the question we're asking you today. Will the Health Minister Dr Zweli Mkhize's visit to Northdale Hospital mean better provision of facilities at other clinics and hospitals around the country where there has been concerns about inadequate facilities?